Hello, I am Meredith Rodriguez. I am a physical therapist at Cleveland Clinic Children's. I work at both the Beechwood location and I am one of the physical therapists in our Be Well Kids Clinic. So today I am here to talk about managing and preventing youth sports injuries. So we can dive in here. Okay, so today, my plan is to highlight both the psychologic and physiologic differences between adolescent and adult athletes and recognizing the role that these differences play. Also, helping you understand different injuries that are common in the pediatric population, as well as ways to prevent and manage these injuries. And then I will also define sports specialization, and we will discuss what the impact of sports specialization is on youth athletes. Okay, so before we dive into all of that, I think it's really important to highlight all of the benefits of adolescent sports participation. So thinking about the strong sense of self and identity for youth athletes, sports are really important for them. It also, another benefit is the reduced risk of obesity, improvements in overall physical health. So, improvements in muscle mass, improvements in endurance, and improvements in bone health. There are also decreased rates of depression and anxiety for individuals who participate in sports, as well as higher levels of self confidence and self esteem. Participation in sports for adolescents has also been linked with higher academic performance and more likely to attend college. And really looking ahead, it is also linked to a higher earning potential in adulthood. Um, Another thing to highlight is just thinking about overall improved physical literacy. So physical literacy is the motivation, the confidence, the physical competence, knowledge, and the understanding to value and take responsibility in physical activities for life. So it's really thinking about exposing children to various sports and different movement patterns so that they feel confident and are able to participate in sports long term, thinking lifelong. Okay, so youth athletes are not small adults. So thinking about what makes these athletes different than an adult. So a few factors. So adolescent athletes are skeletally immature. So their bones are not fully developed. So therefore they are at an increased risk of injury as the growth plates aren't closed yet. And so therefore when there's a high stress that could result in injury. Also, when these individuals are growing, so our bones actually grow faster than our soft tissue, so our muscles. So you're seeing increased length of bones without the muscles growing at the same rate. So oftentimes, adolescents tend to be pretty tight, just overall decreased flexibility at this time, but that can place more stress on the bone with those muscles kind of pulling at the attachment. Um, Another aspect thinking about the differences with these athletes is that there is an altered center of mass. So as our kids are growing, the center of mass actually is lowering, which may result in just a period of time of them being a little more clumsy, just less coordinated, and they do need some time to just adjust to different movement strategies. Cartilage is also more vulnerable at this time, and there are also different psychological factors to consider when we're working with these athletes. So thinking about the influence of peers. So, um, you know, as far as like what their peers are doing, as far as like participating in sports, it's really important for their identity to be involved in these sports. And then also what they're seeing on social media that can impact how they perceive their performance. And just knowing and recognizing that their brain is not fully developed yet. So just being aware and cognizant of that when working with them is really important. And I think it's really important to find providers who are familiar with working with adolescent athletes, just even being able to kind of consider those psychologic factors, and especially when you're making decisions of return to play, and being a little creative as far as how can we make our children and athletes feel as though they're able to do as much as possible, even if there is a time of injury. Okay, so there are also gender specific considerations. So there are strength differences for males and females once they hit puberty. So up until puberty, males and females have the same capacity for strength. But following puberty, males actually have a greater capacity to increase strength due to the hormonal changes. So that's something to consider throughout the rehab process. Um, Females also tend to reach peak height velocity and maturity earlier than males. So it tends to be 12 compared to 14 years of age on average. And there are also bony alignment considerations. So the female pelvis is widening. So just considering that that does alter the lower extremity alignment. So looking at the angle of the legs and the knees, and understanding that that does play a role as far as different injury risk. Okay, so as far as prevalence and risk factors for adolescent injuries, so there's quite the range. So the prevalence of sports-related injuries in adolescent athletes ranges from 34.1% to 65%. There are different risk factors, though, that are pretty evident. So thinking of BMI. So individuals with an elevated BMI are at greater risk of injury. Physical activity patterns and training practices do have a role. So thinking as far as, for example, for physical activity patterns, if you have an adolescent athlete or young athlete who is participating in a fall sport, but they haven't necessarily trained throughout the summer, they took the summer off, which, we'll talk about that later, but there are some benefits. But just thinking about a gradual increase of exercise is important. And as far as training practices go, what is the frequency of training? And, is there strength and conditioning involved in their training? Also looking at, so age and gender. So younger athletes and females were found to be at a greater risk for injury. And certain sports do put you at an elevated risk. So two of the sports that were found to have some of the higher risk of injuries are soccer and football. And having a previous injury does place our athletes at a higher risk of having a subsequent injury. Okay, so we will go through a few of the common injuries in pediatric and adolescent athletes. It's certainly not an exhaustive list, but definitely some of the more common injuries that are seen. Okay, so we will jump into sprains and strains. So a sprain is a partial or complete tear of a ligament versus a strain is a partial or complete tear of a tendon or a muscle. So there are three different levels of severity. So grade 1 being the least severe, and grade 3 being the most severe or a completely torn ligament. So as far as thinking about symptoms, so you may see some bruising, swelling, pain, and instability, especially with the greater severity of injury. And then for muscle strains, also there are the three different grades or three different severities, with grade 1 being the most mild, and grade 3 being the most severe or a complete rupture of the muscle. So symptoms, again, will vary based on the severity, but looking at, is there bruising, is there pain at rest, swelling, and then especially with those more severe injuries, there will be weakness of the muscle or complete loss of function. Some risk factors for muscle strains are tightness. So thinking about our young athletes who we already have said that their bones are actually growing faster than their muscles are. Oftentimes these individuals are tight. So that is a factor thinking about muscle strains. And also thinking about a fast increase in intensity, duration, frequency of an activity all place an individual at a greater risk of injury. Muscles that are fast twitch, so thinking about like the muscles that help with sprinting or those really fast movements, are more commonly strained. So hamstrings, calves, hip flexors, adductors, so the muscles on the inside of your leg, and erector spinae, which are back muscles, and the rotator cuff. All right, so other injuries are overuse injuries. So overuse injuries are the result of a discrepancy between the volume of the stress or force applied to the body and then the body's ability to absorb that force or manage that stress. So if there's too great of stress, the body breaks down. So it could be a result of either repetitive small traumas to healthy tissue or a buildup of traumas to an otherwise like unhealthy or already impaired tissue. Some common overuse injuries that we see in adolescent athletes are medial tibial stress syndrome. So those are shin splints, more commonly known. Different tendinopathies or tendinitis, patellofemoral pain syndrome. So that's anterior knee pain. IT band pain syndrome. So the IT band runs from the like top of your hip basically to just below your knee on the lateral side. OCD or osteochondritis dissecans, and then apophyseal injuries. So this is where the muscles and the tendons are pulling on the growth plates or that area of the bone. So that's Osgood-Schlatter's, Sinding-Larsen-Johansson, Severs, and Eisland's disease. And as far as different symptoms for overuse injuries, it does certainly vary based on the location and the severity. But looking at, is there swelling? Is your athlete having an altered gait pattern? Or, walking differently? Are they having pain? Those are all just something to kind of cue you in to, maybe there is a little bit of an overuse injury going on. Other factors, so we can think about intrinsic risk factors and extrinsic risk factors for these injuries. So intrinsic risk factors include different bony alignment in the structure, nutrition, strength, body mechanics, and BMI. And then also thinking about the extrinsic risk factors, so training load and the equipment and the play surface. These may all have an impact at putting our athletes at a greater risk if they're not optimal. Okay. So moving ahead to fractures. So I will note that if you look at stress fractures, they're actually a type of overuse injury. But it is affecting the bone. So again, that's a result of repetitive stress placed on the bone without adequate recovery. And females are more at risk for stress fractures than males, but certainly can happen in males as well. Symptoms for these may include tenderness, swelling, increased pain, with force applied at the bone. And they're sometimes a little tricky because x-rays, especially initially, do not necessarily pick up on stress fractures. So there are a few different tests that providers can do. So um, again, it's certainly finding providers who are familiar, have um, the, you know, the recognition to look for something like this if there are some factors that may lead to this being a consideration as an injury. Um, Thinking again, so growth plate fractures, so Salter-Harris fractures, those are fractures that happen at the growth plate of a long bone. And then other common fractures in this population are avulsion fractures. So that is when there's a separation of the bone fragment at the site where a tendon or a ligament is attaching. And those injuries are more common in sports where there's like sudden movements or change in direction. So that can include soccer, gymnastics, tennis, football. And I do want to go back quickly to stress fractures and just thinking again about some of like the risk factors for those. So as far as different sports that it's more commonly seen, that would include running, gymnastics, dance, basketball, tennis, and track. And I also want to make note that early sports specialization, which we will cover towards the end as well, but that does place individuals at a higher risk to develop stress fractures. Okay, so concussions are another injury that are seen in these young athletes. So a concussion is a type of traumatic brain injury that is the result of a blow to the head or body, which causes a rapid rotation of the brain. So some symptoms include headache, confusion, memory impairment, and difficulty concentrating. Um, Athletes in contact sports are at a greater risk for concussions, but certainly can happen in non-contact activities as well. As far as identifying and treating, so if there's any suspicion that an athlete may have sustained a concussion, they should be immediately removed from play and then evaluated. There should be then an individualized approach to a gradual return to play. The process for that is going to include not only physical rest, but also cognitive rest. And I did note that it is estimated that over 95% of high school athletes recover from a sports related concussion within 1 month. Okay, so thinking about when do we seek medical attention for young athletes? So, I think as a parent, it can be sometimes challenging to know when and who to reach out to. But certainly, as far as when to seek help, if you are recognizing or your athlete is reporting any pain that's impacting their ability to participate, or if you recognize that they're participating, but their body mechanics are impaired, certainly it's time to seek help. Um, I also think it's certainly okay to ask for help even before an injury occurs. So, having conversations with your athletes' coaches or athletic trainers, whoever might be there supporting them and their team. Just thinking about how can we even prevent these injuries? And we will go through some injury prevention, but I think just keeping it in our mind to, that it's okay to be aware of the risk for injuries and, putting a plan in place before an injury may occur. I would say then, first step would be reach out to your child's pediatrician if you have a concern. Oftentimes, your child's pediatrician is able to then determine is it appropriate to see an orthopedic physician for a more specialized approach. Um, Is it indicated to have any imaging? And then they also would be able to refer to physical therapy. Um, and certainly, I guess, when I'm saying reach out to your physician first, certainly if it's an acute injury, that is a different story. If care needs to be um, received immediately, then of course going to emergency room. But a pediatrician or an orthopedic physician would be able to place a referral to physical therapy. And then a physical therapist is able to create an individualized plan for your athlete to help return to play and prevent future injuries. So, working on building strength, working on range of motion, overall mobility, and education. So, I think it can be a really valuable tool for these athletes to have that opportunity too, because I think they can learn things not only to rehab the current injury, but thinking ahead as a lifelong athlete, learning some new skills. Okay, so thinking about management of soft tissue injuries. So historically, I'm sure we're all familiar with RICE, which was the previous recommendation. So rest, ice, compression, and elevation. Um, but what this did not take into consideration was how to manage these injuries from more of a subacute or chronic standpoint. So now the acronym is peace and love. So for an acute injury, we can take a look at just like the peace component. So protect, elevate, avoid anti-inflammatories, compress, educate. And so one of the biggest changes here, I would say, would be the lack of recommendation for anti-inflammatories and using ice. So there is not great evidence to show that ice actually is helpful in the healing process, and more recent research indicates that maybe it actually could have a delaying effect on healing. So that is no longer the recommendation after the first few hours. Looking at the next stage, so load, optimization, vascularization, and exercise. And I apologize, optimism. So just thinking about making sure that there are positive conversations about return to play, and keeping our athletes kind of in a positive spirit when they are returning from an injury. Okay, so injury prevention strategies. So thinking about strength training. So strength training is a form of training that allows for overall improvements in muscular strength, endurance, and muscular power. It has not only been shown to be safe, but also a very beneficial tool for children and adolescents. And there is no research right now that indicates strength training negatively impacts growth. And it is estimated that exercise programs that do have an emphasis on strength training prior to and during sports seasons, it actually may help prevent more than 50% of sports related overuse injuries. So that's a huge thing to be thinking about and considering. Okay. So as far as the benefits of strength training, so we already mentioned reduce risk of injury, overall improved physical literacy, motor skill development. Um, it can be a component of injury rehab. It can improve body composition by increasing lean muscle mass and improving bone mineral density. I would say that it's important for strength training to be completed under the supervision of an individual who has good understanding of proper form so that they can provide feedback to athletes. Um, and there also should be a gradual increase as far as how we are loading these athletes. So, for individuals just starting out with strength training, it's great to use just body weight. Um, and then eventually progressing to free weights or resistance bands. If your athlete is in a gym where there's access to machines, that's also a good tool. But again, really making sure that these are all fantastic tools, and also a coach or a trained professional should be there to monitor and make sure there's proper form so that they're getting all the benefits of strength training and not being placed at a risk of injury if movement patterns are not completed in the proper way. Okay, so other things to consider from the standpoint of injury prevention. So, nutrition and recovery. So, we want our athletes eating a well balanced diet. So, thinking about healthy fats, complex carbs, and protein. Also, making sure that they're hydrating appropriately. So, it's recommended to get 5 to 9 ounces of water or fluid every 15 to 20 minutes of prolonged exercise. It is also recommended that adolescent athletes have a snack 90 minutes before exercise, and then they should also have a snack 30 to 60 minutes after exercise to refuel. We also want to make sure athletes and teens and children in general are getting their proper rest. So, the recommendation for sleep for school age children is 9 to 12 hours and 8 to 10 hours for our teens. It is also important to be considering that these athletes should have a day off of intense exercise. So, participating in sports 7 days a week is not indicated, and just making sure that there's a balance between that training, which is great, but also giving their muscles and just psychologically the chance to just rest and recover. All right, so things to be mindful of. Just having a discussion with coaches and understanding training expectations. I think it's great to open up that communication to have a good understanding of what are the expectations for the team, what are the training practices, is there strength training, um, is there dynamic warm-ups, and all of that I think has been, when I've spoken with adolescent athletes and their families, I think a lot of schools are doing, it seems like, a pretty good job with some strength training, but certainly is a good conversation to have. Also, being mindful of making sure your athlete has proper equipment. So, for example, if an athlete signed up for cross country, making sure that they have the proper shoes. So, I think that's one of the sports that it's really important. I think every sport it's important to make sure there's proper equipment, but making sure that we have good shoes, our equipment fits, and then just monitoring your athlete for any signs of burnout. Okay, and then thinking about sports specialization. So, what does this mean? So, sports specialization is defined as intense year round training, so that is greater than 8 months of the year, in a single sport with the exclusion of other sports. Early sports specialization is defined as this, but prior to the age of 12. Okay, so here are different criteria for kind of understanding what is the degree of sports specialization for a child. So, low specialization would be meeting 0 to 1 of the following criteria, and then we can see moderately specialized 2 of the following, and then highly specialized is meeting 3 of the 3 different components. So that would be year-round training, so greater than 8 months, choosing a single sport, and then quitting all other sports to focus on one. So if you take a look at this, it does demonstrate that the risk of injury and the risk of serious overuse injury increases with the higher levels of sports specialization. And it is interesting to note, so the risk of acute injury is actually lower for the moderately specialized and highly specialized individuals, but it's really important to be thinking about, making sure that our children and teens have a number of sports that they're participating in and have been exposed to get the variable movement pattern. So, for example, I'm going to use running again as an example. So, if you think about it, running, the movement is really just in the like forward and backward plane. So that's the sagittal plane of motion. So if your athlete or an individual is really only doing that like forward and back movement pattern, they're not able to get the benefits of that side to side movement, and just thinking about strength in different muscle groups. It's really important to have that variable movement pattern to reduce risk of injury. Um, so that is certainly something to consider. And I think that, especially with young athletes, so important that they're able to just try different things.